In the name of God. I'm Dr. Yalda Torabi from Iran. Thank you very much for allowing me to have presentation in this Congress. Our title of our study is Immediate Clinical Evaluation of a 914 nanometer diode laser assisted in-office bleaching. Dental bleaching has become one of the important parts of aesthetic dentistry. It is one of the most conservative treatment of discolored teeth. For this purpose, techniques and materials are being developed. Lasers, non-coherent light sources, and heat may be used for the activation of the bleaching agent in order to accelerate tooth whitening. However, early methods of physical activation of hydrogen peroxide, such as light or heat, were related to increased tooth temperature and sensitivity. In order to avoid adverse effects of light-activated bleaching, modern light sources like xenon halogen lights, LEDs, plasma arcs, and diode lasers have been developed to produce greater brightening results with less heat generation. In fact, bleaching with diode laser has been shown to result in less tooth and gingival sensitivity than the other bleaching systems. Nevertheless, because the validity of adjunct lights in tooth bleaching is controversial, rigorous studies are still needed to explore the advantages of these available systems. Recently, a new bleaching system was introduced to the market associating a highly concentrated hydrogen peroxide with 46% hydrogen peroxide activated by diode laser at 940 nanometer or 810 nanometer. That is laser white 20 from BioLaser of USA. The purpose of this study is to evaluate the immediate efficacy of this new in-office bleaching system associated to 940 nanometer laser compared to the results obtained by a non-irradiated conventional dental bleaching treatment. That it is the conventional was the White Smile from Power Whitening of Germany. Methods and material. 20% from 20 to 35 years of age participated in this study. The participants had no extensive carious lesions and prosthetic restorations in their anterior teeth. They had no painful symptoms or hypersensitivity in their anterior teeth, and they had no tetracycline stained teeth. All the participants had optimum oral hygiene and vital teeth, and they had no gingival irritation or periodontal disease. All of them were non-smoker, and they were not pregnant or lactating. All the volunteers who had used tooth whiteners within the preceding 3 years were excluded from the study. The experimental design of this study was a clinical study with a split mouth design. Teeth in the maxillary and mandibular right quadrants were allocated to the laser-assisted bleaching technique with 46% hydrogen peroxide, and for the left quadrants, a conventional bleaching gel with 38% hydrogen peroxide without laser irradiation was applied. One trained evaluator recorded the initial and final color of the evaluated teeth using a spectrophotometer, that is shade star from the Godent of Germany. The colors were evaluated immediately after bleaching process, and to obtain reliable results, all the volunteers were treated in the same room lighted with artificial light. In each quadrant, 4 teeth were subjected to treatment: central incisor, lateral incisor, canine, and first premolar. At first, the stains and dental plaque were removed with scaling and root planing. Teeth surfaces were cleaned using pumice that did not contain glycerin. After cleaning procedure, the teeth were not fluoridated to avoid interference with the penetration of the active components of bleaching gel. To protect the soft tissue, the lips were lubricated with Vaseline, cheek retractor was used, and gingival margins and all the embrasures were covered with gingival protector. Bleaching gel that was used for right quadrant was laser white 20 from Biolaser of USA that contained 46% of hydrogen peroxide. The laser that activated bleaching gel was Easy Laser from Biolaser of USA. It is a diode laser with 940 nanometer wavelength. The fiber diameter was 400 micrometer and the power of the laser was 7 watt. For right quadrants, the fiber was moved against the tooth surface in non-contact mode about 1 millimeter apart to avoid contact with the gel or the tooth surface. As soon as the patient reported a sensation of heat generated within the tooth, laser radiation was stopped and the operator proceeded with the adjacent tooth. This process continued for 10 minutes, after which the gel was rinsed. For left quadrants, the bleaching gel that was used was White Smile from Power Whitening of Germany that contained 38% of hydrogen peroxide. And for left quadrant, only the gel was placed on the tooth in each quadrant and rinsed after 10 minutes. For a statistical evaluation, after bleaching procedure, shade values were converted to scores ranging from B1, the lowest value, to C4, the highest value. For a statistical evaluation, means of shade score within teeth, quadrants, and jaws were statistically compared by the ANOVA, complemented by the Tukey's post hoc test. To compare shades before and after treatment, both dental modalities, between both dental modalities, PERTI test was used. All data was analyzed setting a significance of 5%. Results. Data from each tooth category individually showed no significant differences between treatments in both arches. Moreover, the results suggest that both treatments were less effective in the lower jaw than in the upper jaw, especially for the first central incisors. Best results in color changes were obtained for canines. For the overall treatment, for example, when tooth categories were evaluated all together, both treatments were effective in whitening tooth color in lower and upper arches. This graph shows comparison between laser-assisted system and conventional treatment in the lower and upper jaws. Comparing both treatments, laser-assisted systems proved to reduce more shade units than conventional treatment in both arches. Discussion. Both laser-assisted treatment and conventional treatment were effective in promoting tooth whitening. Nevertheless, laser-assisted system resulted in significant lower shade values in both upper and lower jaws when compared to the conventional treatment. Laser-assisted system has shown improved result than the conventional system. The use of supplementary light on the effectiveness of vital bleaching treatment is still controversial, even for laser devices. But 3 types of lasers have been approved for laser-assisted treatment bleaching by the FDA: argon ion laser, carbon dioxide laser, and diode laser. Significant changes used in office bleaching systems and diode lasers were reported in the literature. However, the positive effect of light irradiation on tooth whitening efficacy was not confirmed in some studies. Lack of evidence may be due to the multiple methods used to analyze bleaching efficacy, such as bleaching protocols and laser exposure parameters. It is important to notice that this study was not conducted to verify the use or not use of light activation to improve dental bleaching, such as the hydrogen peroxide gels investigated here have different gel concentrations. The best results obtained in the laser-assisted treatment cannot be assigned exclusively to the laser activation once the hydrogen peroxide concentration used in this system is higher than the one applied in the conventional system used as control. Besides it is already known that high concentrations of hydrogen peroxide, between 25 to 35% of hydrogen peroxide, itself can quickly produce enough radicals capable of reacting with pigments. Hazard to the dental structure is a great concern related to dental bleaching. The enamel behaves like a semi-permeable membrane, allowing the passage of water and other substances with a small molecular size, such as oxygen ions present in the hydrogen peroxide. Many studies were performed in order to verify the permeability of dental tissues to different concentrations of hydrogen peroxide gels. The power energy used in the current study was 7 watts, as recommended by the manufacturer. In spite of this, only a few patients reported a sensitivity or discomfort. Although the laser-assisted treatment evaluated in this study was well tolerated by the patients, the highly concentrated hydrogen peroxide might be better investigated in relation to its penetration capacity through the dental tissues and its possible biological hazardous effect on the dental pulp tissues. The mandibular teeth were harder to bleach than the maxillary teeth, even for the laser-assisted treatment. Besides the thinner enamel layer, especially in the anterior teeth, other possible reason for this finding may be attributed to the reduced surface area of mandibular teeth to the gel. A significant overall increase in whitening was observed for canine, respective to the treatment type. Similar results were previously reported. Although the result of this study showed that the laser-assisted dental bleaching was able to improve tooth whitening when compared to the highest concentration of a conventional system available in the market, future studies should be conducted to examine whether the protocol is effective when evaluating only the light activation effect. Moreover, future studies might investigate the biological implications of the use of highly concentrated hydrogen peroxide gels in short and long terms. And finally, conclusion. After treatment, all patients had significantly whiter teeth than before treatment, irrespective to the treatment type. However, laser-assisted treatment using diode laser at 940 nanometer resulted in an enhanced tooth whitening outcome in an immediate post-bleaching assessment. These are the references of the study. And also, thank you for your attention and good luck.
I got it right.
Thank you.
Dr. Ardekani?
Torabi Ardekani.
Okay, good enough. Okay, I butchered
Thank
it the
you.
first time. I'm sorry.
Thank you.
Thank you very much.
Thanks.
Any questions for the doctor? Okay, I have a question then. They told you to do this, by the way. This isn't naturally made. So how come you didn't use the same concentrations for both? You could have just used the same whitening solution, using it one way with diode and one way without, and that way you would have had a similar concentration.
We wanted to compare two brands of bleaching gel with diode laser from BioLase, because the pack of the gel and the laser is all together from BioLase. And we want to compare this method with a conventional one.
Okay.